Okay, so come up here and you can type in the patient's name. I'm just going to double click my name, and it has the side-by-side images presented a little differently. Now what they have done here is they want you to hold the left mouse button down and move your mouse up or down to zoom in or out. So I'm going to hold in the mouse button and push up, and then the other one will follow. To move the images, you click and hold the right button and move them over like that. Up here is all your controls. That controls the gamma. This controls the, I think, black and white, or darkness I mean. That's the enhancement. This is the red-green blend. I'm going to click that. And now when I go back to here, again I'm going to hold the left mouse down and go up, and it gives that view, and for some reason you have to go over here to do it on that view, and then you hold the mouse down and go down to check the blood vessels. Now the tricky part is if you want to zoom in or out from here, to move around, you hold the left button, the right button, and move it over. Unfortunately, it doesn't do it as smoothly as the old machine, the old program, but this new machine is the only way we can do it. And so you move it around that way, clicking and holding the right button. But if you want to zoom back in or out, you can't just use the scroll button. You have to come over to here and go back to the zoom. And now you press and hold the left mouse button and zoom out again, and it will do the zoom together, and it will do the movement together. It's just a delayed, not at the same time. And then to go back to the normal view, I think you hit this reset button and it goes back to normal view. And then for the 3D, you come up here and go to views and go to 3D view, and it only does one eye. And in order to move it around, you have to go up here to the rotate button, and now you can help them understand it better by moving it around like that. And then the only way, you can't X them out, the way that you X them out when you're all done is just to come up here. That's not coming into focus. Well, right here is the, there we go, patient directory. You click that button again and it goes back to patient directory. So it's going to be a little bit of a learning curve, and actually so far I don't like it as well, but again, unfortunately it's the only option at this point.